special show at the cutting edge of new technologies. Among all our senses, vision is obviously one of the most vital. Biomedical engineers are now able to tackle one of the most difficult current challenges, such as correcting body part malfunctions by creating biomedical devices directly impacting and helping people's lives. Today we will focus on one particular innovative invention called EBS technology. In a few words, it is an electrical treatment restoring vision loss due to neurological condition. But I won't tell you more about it because today we are glad to welcome two special guests. Anne-Laure Lemaire, a well-known ophthalmologist who has worked with biomedical engineers in order to develop this new technology and who will give us her medical point of view, and Kathleen Coutis, a young patient who has had the chance to benefit the therapy and who will give us her own point of view and feelings. Hi, we are now in the office of Anne-Laure Lemaire, the well-known ophthalmologist, and we are going to ask her a few questions about her invention and how the mechanism works and so on. Hello, Mrs. Lemaire.
Hello.
Thank you so much for answering our questions. So, correct me if I'm wrong, but I think there are several causes of visual losses and dysfunction, and the EBS therapy focuses on visual field losses caused by neurological disorders. Is it alright?
Yes, you're absolutely right. Neurological disorders may be strokes, traumatic brain injury, as well as several types of glaucoma. Some disorders may be caused by car accident, for example.
Is that what happened to your patient, Kathleen Coutis?
Yes, it is. After a car accident, neural networks have been damaged. Neural cells and their connections have been lost that have led to an impairment of vision.
And now, could you tell us a little bit more about this new exciting technology? I mean, a little bit more about the mechanism and the different components?
Yes, the EBS therapy is an electrical stimulation device that is individually adapted to the patient's condition. After a brain injury, neuronal networks are damaged and the connections between neurons are lost. The cells are now inactive, which lead to a loss of vision. So, how can we salvage the situation? During the therapy, the patient has to wear an EEG cap and stimulation goggles. These stimulations are applied by 4 electrodes above and below the eyes. The pulses stimulate the cells of the retina and signals run through the optic nerve into the visual cortex of the brain. The patient perceives the stimulations as light sensations and silent neurons are reactivated and reincluded into the network. The result is then a recovering of vision.
We are going to listen to the story of Kathleen in order to have the other side of the therapy from the patient wants and her feelings during the process.
I'm really happy to have met Dr. Lemaire, who proposed me to try the EBS therapy. Well, I had to go to a specific neuro-ophthalmologic center to benefit this technology. It's my responsible physician that decided if I could undergo the EBS therapy, and he was the only one able to. Before the therapy, a complete preliminary investigation has been required to determine my condition and estimate my residual vision performance. Of course, I also did other tests to ensure that there weren't any medical risks that could have led to undesired side effects in the course of an electrostimulation. Then, the EBS therapy in itself consists of 10 sessions which are held on 10 consecutive days. The hardest moment of the therapy was to stay near the center during more than 1 week. However, one session lasted 7 minutes. Each day, all necessary parameters depend on my daily condition, and we use them for the simulation. At the end of the therapy, a global examination is conducted to check results. I can tell you that the 10th day I was really relieved, and I crossed my finger for the analysis to be positive.
Now that you have explained us the different steps of the therapy, could you confess what it has involved for you? I mean, was it really successful, and do you think it was worth it?
Yeah, I'm really happy to have received this therapy. If after the first session the improvements are not so much significant, we have to undergo a new session. But for me, the results were directly significant. So Of course, my life is not perfect now, but my vision troubles are significantly reduced.
Before, I feel quite bad because of my eye problem. I was a bit rejected from the society because it's a real handicap when you can't see enough the world around you. Now, it's totally different. I can follow my lesson and not to be forced to stay in the first round. Besides, almost once a day I didn't recognize my friend or I didn't see the obstacle. And now, I don't show people in the street anymore. I can say that the EBS therapy changed my everyday life.
So as you have seen, EBS therapy has really improved Kathleen quality of life. And that's the ultimate aim of biomedical engineers, impacting and helping people's lives thanks to technology. But of course, the therapy is not yet perfect and is not as successful as for Kathleen for every patient, and does require engineers in order to tackle the remaining failures of the system, as well as the hundreds of projects biomedical engineers are currently working on. Anyway, as further research leads to new questions and innovative invention, technology progress never stops and do require our help. Thanks for watching and see you soon on our channel.